What are companion diagnostics for skin cancer treatment? Imagine having a tool that helps doctors pick the best treatment for your skin cancer based on your unique tumor. That's what companion diagnostics do. They are specialized tests that give crucial information about your cancer's genetic makeup. This helps determine if a targeted therapy will work for you and whether you might face serious side effects. These tests work alongside the drugs to make cancer treatment more precise and personalized. Instead of giving everyone the same treatment, doctors can now tailor therapies based on specific genetic features of each tumor. This shift has changed how skin cancers like melanoma are managed, making treatments more effective and safer. In targeted therapy for skin cancer, companion diagnostics serve for main roles. First, they identify patients who are most likely to benefit from a particular drug. Second, they find those at higher risk of adverse reactions, so doctors can monitor or adjust treatment. Third, they help track how well the treatment is working, allowing adjustments to improve safety and results. Fourth, they confirm that a patient fits the profile of those studied in clinical trials, ensuring the treatment's safety and effectiveness for them. For example, in melanoma, a drug called vemurafenib targets a specific mutation called V600E in the BRAF gene. Before starting this drug, a companion diagnostic test must confirm that the tumor has this mutation. If the mutation isn't there, the drug won't work and could cause unnecessary side effects. This test ensures only patients with the right genetic profile receive the drug, maximizing benefits and reducing risks. Research shows that pairing targeted drugs with companion diagnostics significantly improves treatment outcomes. Response rates with these paired approaches can range from about 41% to over 80%, compared to lower rates when treatments are used without diagnostics. This difference highlights how companion diagnostics help doctors select the right patients for the right drugs, leading to better results. They allow doctors to look beyond traditional factors like tumor size or location, and instead focus on the molecular and genetic features of each cancer. This approach helps target the cancer's specific vulnerabilities while sparing healthy skin and tissue from unnecessary harm. Developing companion diagnostics involves a process called drug diagnostic co-development, where the test and the drug are created together. This ensures the diagnostic is accurate and reliable for identifying patients who will benefit. The U.S. Food and Drug Administration oversees these diagnostics as medical devices, requiring strict standards for safety and effectiveness before approval. Sometimes, a single diagnostic test can be used for multiple drugs that target the same biomarker, making testing more efficient. However, for complex genetic markers, individual tests for each drug may still be necessary. In everyday clinical practice, when a person is diagnosed with melanoma or another skin cancer, a sample of tissue or blood is sent for testing. The test looks for specific genetic mutations or biomarkers in the tumor. If the results show the presence of a targetable mutation, the doctor can confidently prescribe a targeted therapy designed to attack that mutation. If the cancer recurs or progresses despite initial treatment, the same testing can be repeated to find new mutations that may have developed. This adaptive process helps doctors choose the most effective targeted therapies at each stage, making treatment more personalized and responsive to changes in the tumor's genetics. Overall, companion diagnostics are transforming skin cancer care by making treatments more precise. They recognize that each tumor is unique and requiring a tailored approach. By matching each patient's genetic profile with the right targeted therapy, these tests help improve outcomes and reduce unnecessary side effects. They support the goal of personalized medicine, where treatment is based on the specific characteristics of each individual's cancer. Always remember, if you or someone you know is facing skin cancer, it's essential to consult healthcare professionals who can recommend the most appropriate tests and treatments based on the latest scientific evidence.